Our next guest turned his personal health battle into a life purpose, working his way from heart patient to heart physician. Joining us today to share his story is cardiology fellow at Bay State Health, Dr. Colby Salerno. Welcome to the show.
Thank you. I appreciate you having me on.
Doc, this is a great story. So, Dr. Salerno, at age 12, you were given life-changing news. Tell us what happened.
Yeah, when I was 12, I was an avid soccer player, and I was playing on multiple soccer teams, but I started to have a lot of trouble breathing and really started to struggle. And I was actually just at a routine medical visit, and the doctor felt that they heard a murmur. So they sent me to a pediatric cardiologist who did an echocardiogram, ultrasound of my heart, and told me the news that really changed the trajectory of my life and told me that I had hypertrophic cardiomyopathy. And when I was 12, I thought I was going to be a pro soccer player. So this changed my whole outlook and kind of set me on a new path.
That's a big deal as a kid, realizing that there are going to be some things I can't do now, Dr. Salerno. So what was it like living with your heart condition?
Yeah, it like I said, it changed my whole trajectory. I didn't feel that different other than having to quit sports. But at 14, I needed my first defibrillator, implantable defibrillator. And I remember having the bump in my chest and going to pool parties and being concerned about people looking at it and not wanting to take my shirt off. Yeah. Thankfully, though, I had a great group of friends that surrounded me, and I ended up living a mostly normal, life. I went through high school. I had friends. I got to go to proms and everything. And at that time, I just thought, let me apply to college and see if I can maybe go to med school one day.
So, Dr. Salerno, tell us, when did your heart condition take a turn?
When I was in college, I was trying to get a biology degree, doing all the pre-med requisites, and the plan was to go to med school after college. But during college, just even a single flight of stairs, and I couldn't breathe by the time I got to it. And when I would go to class, if I was rushing to class, I would get to the door and not even be able to go in. It started to affect my vision and my whole body. So after I graduated college, I went back to my pediatric cardiologist, who I was still seeing, and told her about my symptoms. And she sent me to a specialist in Boston. And I had gone there thinking that I, was a whiz kid and thought he would just do a simple procedure, open up the blood flow in my heart, and I'd be good to go. But he came in the room after a few tests and said, "I'm sorry, but your heart, the simplest way to put it, is kind of burned itself out, and you're going to need a heart transplant."
That must have been a really scary feeling at that time.
Yeah, I cried my eyes out with my parents. I remember just being in the room with the two of them, crying my eyes out. But, since 12, I kind of had these hurdles thrown at me, and I just kept going.
Well, and Colby, tell us, how did the transplant go?
It went amazing. It was the best thing to ever happen to me. In May, I'll be 10 years post-transplant. And like you said, when you introduced me, I got to where I wanted to do in my career because of this and got to become a cardiologist.
That is fantastic. And Dr. Salerno, you're now a cardiology fellow. How does it feel to be on the other side of the stethoscope?
It's incredible. It's really something that I cherish. I ended up needing to live in the hospital for 6 months while I waited for my transplant. And during that time, I got a true inside look of what it's like to be a patient and to have chronic disease. And one of my physicians, no fault to him, I remember him saying, to me that I know it must be hard. And I remember thinking, you don't know too much because I'm the one stuck in here. And I was like, if given the opportunity to actually know what my patients are going through, I'm going to take that chance. And so I'm on my path to become an advanced heart failure and transplant specialist. And so when I get to sit down with patients and talk about having open heart surgery, cardiac catheterizations, an implantable defibrillator, it's really rewarding to them, for me, to see them see an optimistic outcome that's possible for them.